Hey everyone, my name is Madison Benton and I'll be doing a skills presentation for you today for EMS Instructor Methodology. For this course, we're going to be covering a vital skill for any EMS provider to know, which is hemorrhage control. According to the American College of Surgeons, hemorrhage control is the leading cause of preventable death after traumatic injury. With that said, May is also Stop the Bleed month, and we're in May, so it's a perfect fitting time to go over this type of skill. For the purpose of this presentation, we're going to be going over the use of a commercial tourniquet, a commercial wound packing material or gauze, particularly in this case quick clot, and we're also going to be covering pressure bandages. We have our trainer leg in front of us. It is worth noting that it's obviously a lot easier on this, so take that into consideration when you're doing your training, that if you can get a real person to practice tourniquet use, all those things I highly recommend, especially when you're practicing your wrapping or pressure bandages. Real person is great, but for the purpose of this video, we're going to use this training leg, which is actually provided by North American Rescue. So check their website out if you really like this material and like to use it for yourself. Quick information about me. I'm a paramedic, been a paramedic since 2020. Working in the Army as active duty medic now, and I really am passionate about trauma. It's a big focus of our training, of course, is trauma. So with that said, let's jump right into it. So first you have your tourniquet. Again, we're going to commercially available device. There's also the Soft T Wide as another option, among others, but I would say the two most popular are a CAT Gen 7 and the Soft T Wide. Today we're using the CAT Gen 7. It comes prepackaged, already looped like this. Personally, however you want to prepare it is up to you. I like to have mine unlooped. If you're wearing it on your person for self-application, then looped is great, but otherwise I think it is much better unlooped. So again, a tourniquet is going to be used for life-threatening hemorrhage, particularly arterial bleeds, looking for squirting hemorrhage, large amounts of hemorrhage that's not controlled just by simple pressure alone. And a tourniquet is useful for extremities, both upper and lower. It's important to note that you have to reassess and make sure that the bleeding is not in an axillary or inguinal or any other kind of pocket where the tourniquet is not effectively able to manage that hemorrhage. We have a patient in front of us and we've noticed that criteria is met. There's life-threatening hemorrhage, it's arterial bleeding, it's a good amount, it's a soda can or more already building up. Pressure has not resolved the bleeding or stopped the bleeding, then we move straight to our tourniquet. We come with our patient. If you have someone available to assist you, you can have them hold pressure on that wound while you're preparing your tourniquet and you're getting ready to use it. Simply using two hands, that person assisting you will provide pressure. If not, and it's appropriate, you can use something such as a knee to provide that pressure. If it's a leg or a good spot on the arm, you can use your knee and junction points. So if the injury is lower on the person's leg, try not to attempt to cut off supply blood at their inguinal areas. If it's lower on their arm, attempting to cut it off up at the brachial area. With that said, keep in mind the mechanism of injury that your patient has sustained and consider whether or not there's fractures involved that you may want to not cause further harm to. But at the same time, the hemorrhage is what's going to kill them at that moment, and you have to do what you have to do to stop that. So let's say we've applied what we typically call in the military as a stopgap to slow down that hemorrhage while you're getting your tourniquet ready. We simply undo the strap all the way, ensuring that it's flat. You're going to wrap that strap under the patient's extremity with the red side up, so that 2 to 3 inches above the wound. So in this case, we have a laceration here, 2 to 3 inches above that wound. For the purposes of the patient's head I'm going to use this direction. The most important step in this process is to make sure that the initial latch is extremely tight. If this is not tight, you're going to have to do a lot of turns and your tourniquet may end up being ineffective. So once that is extremely tight, you've got as much as you can, wrap that Velcro around. You're going to give as many turns as it takes to stop the control of bleeding, usually generally 2 to 3 turns. Once you have those 2 to 3 turns and you notice that bleeding is stopped, you're going to control this windlass into the latch. You can take your excess Velcro and fit it in there as well if you'd like. Take the cover so that it prevents it from coming out of the latch. Take your Sharpie, write the time that you applied this tourniquet onto this gray marking, or if it's a Soft T Wide, there'll be a white marking. Either one, make sure you write that time. And then you also want to, while you're visually inspecting that the hemorrhage is controlled, also you can check for a distal pulse to make sure that that pulse has been cut off. assuming that it's not an amputation, of course. And that is the application of the CAT Gen 7. Again, if you have a soft TY, it works very similar to this, and you can, of course, use improvised tourniquets, but since this presentation is for EMS providers, we're going to stick with talking about commercial devices only. Okay? Again, this should not be removed by EMS providers. Wait till you get to the hospital, let the surgeon or the ER doc or whoever has those credentials to make that call, let them remove it. You can proceed with wrapping the bandage, applying some kind of gauze over to keep it clean and sterile, and protect that wound. For purposes of this class, we're not going to go over that because we're only focusing on the life-threatening measures. So we're going to take the tourniquet off and move on to our next skill, which is wound packing. And of course, at this time, we'll take a moment to ask any learners that are present, if they have any questions, help them demonstrate the skill, assess their ability to perform the skill, and go over it from there. So here we have two vital components when it comes to wound packing, which is the actual wound packing material itself and a pressure wrap. So these are in the package, commercially available devices. This is Quick Clot Combat Gauze. It contains materials that help promote clotting factors, thereby increasing the chances that the wound will clot off. If you have just regular gauze, your agency doesn't carry this, that's perfectly fine. There are some studies that suggest there's not a difference, while others suggest that these are way better. I'm here to tell you that the most important thing is that you pack it correctly, using the correct technique, and you find the source of the bleed. It's best to have, if you do have this kind of gauze, it's best to have this and normal gauze so that you can apply bulky dressing over the top once you pack with this. These wounds are not very deep in this trainer, and I also was unfortunately able to source some additional gauze, so we only have this type for today's lesson. But keep that in mind when you're keeping stocking your bag, doing your check truck offs, things like that, what you might want in the case that that happens. This is an Israeli style pressure bandage with a latch that allows you to get pressure. It's in the package. I have one here that's already open that we'll be using for today's demonstration. So again, have a latch here for the gauze to go on. Once we unfold it, you'll also see there's a pad which the wound will go on. So first we're going to have our gauze itself. This is Z-fold, which I personally like. There's a few different ways that you can hold this while you're attempting to pack that wound. So here, let's say we have a gunshot wound. It's to a leg, it's to an arm. We do not pack the trunk, of course. If it's a chest, we're going to consider a chest seal from neck to navel. Anything here, we're going to consider inclusive dressing as well. We're not trying to pack these cavities. This is strictly for inguinal pockets, axial pockets, and then if you have a venous wound, or a wound that you apply a tourniquet to that you want to pack. For the purposes of this, we'll be using this leg. Again, there's various techniques you can use to control this. Some people like to particularly put it in their shirt. That way they can just feed it as they're doing it, because you want to make sure that the gauze doesn't touch anything that will contaminate it. Other people like to use just one hand to pack, so they may place the pack on the person's leg, or above the person's leg while they pack with one hand. Whichever technique you choose to use, that's completely up to you. In a more tactical environment, if you're a tactical medic, you're in the military, I certainly think that tucking it into your shirt or a vest, if you have a bulletproof vest on, is appropriate. Otherwise, EMS providers may find it more useful just to hold it in the hand. The most important thing when you're trying to pack a wound, though, is that you don't pack aimlessly. Actually enter that wound. It may be uncomfortable for the patient, but you're trying to actually expose the edges of that wound. And you want to, for lack of better words, debride around that edge so you can actually clear the blood that is in there out, whether that be with some excess gauze, your fingers, whatever's available to you. And you can actually see the artery as it pulses, or find that vein as it's bleeding, so you know directly where that source is. Personally, once I have that, I like to put a finger directly on that area where I don't lose it, and that way I can grab with my index finger and my thumb the gauze, and I can directly pack a good wad onto that pulsating artery, or that very bleedy vein, get that right where I want it. And then at that point, I personally like to put it in my shirt to help hold it. So once I do that, I can pack with two hands. and I can overlap and replace as I'm going, never losing the spot where my bleeder was. And now once that is completely covered and you've got that entire wound packed, you can continue to pull some excess out, take all that excess, put it on top of the wound. And you want to make sure you hold pressure for at least 3 minutes. Give that clot time to take form. Give that clot time to form. Time for the bleeding to be controlled. And then once that 3 minutes is up, kind of reassess. And of course you're reassessing as you're holding to make sure there's no bleed through. But particularly at the end of that 3 minutes, you're reassessing, making sure you have no bleeding. If you haven't already checked downside, which you should, this might be a good time to recheck downside, make sure that entry doesn't have an exit somewhere. Okay? And then once that 3 minutes is up, you can take an ACE wrap, you can take a pressure bandage such as this that we have, and wrap around it to secure that in place until you get them to definitive care. In this case, we're going to use the wound that we have packed to apply pressure dressing. Pressure dressings, again, are effective at maintaining the hold of something that's already been packed, or let's say that you just have a minor bleed on an extremity that you need to provide some pressure to. A great choice for that. I'm going to go ahead and use the one that's not been opened. I think it may be a little easier. And again, at this time, if we were going over packing, we'd ask the learner if they have any questions. Make sure they can demonstrate this the way that it's supposed to be demonstrated. So again, you open this up. You've got the clip here that'll be used to apply the pressure. You've got a pad here, which you will attempt to keep clean. Place that pad directly over the wound. I personally like to apply this to where I'm wrapping towards me, so that way it makes it a little easier. You have your assistant, if you have an assistant, or not, just use your leg to kind of prop that patient's leg or arm up. That first wrap, you can kind of go really tight, make sure you get a good hold, and then just each time through the windlass. And there's a pressure bar underneath this clip. That pressure bar is placed just to the side of that wound. So once you've done your wraps and you're ready to apply pressure, the theory is that the bar on this clip, which I'll show you once we're finished, will pull that directly down onto the wound itself, providing an adequate amount of pressure to control the bleeding and hold the gauze in place. So now we've got our excess pulled. I'm pulling the pressure bar tight onto the wound itself. Now I'm able to wrap one final wrap. Take these clips here to secure your device. Okay, it's secure. Again, I'm checking, I'm making sure there's no blanching or bleed through on the gauze around the edge. I have none. If your patient doesn't have a tourniquet on, this is also a good time to check and make sure they still have a pulse, because it's likely on the extremity you're using this on, you still want them to have a pulse. So you can check to make sure they still have a pulse if the pressure bandage isn't too tight. Remember, this is a pressure bandage, not a tourniquet. It's not meant to actually cut off blood flow. So we check to make sure they still have a tourniquet, or excuse me, they still have a pulse, and the bleeding is actually controlled. Again, this is something that I personally do not remove until you get to the hospital, until you're able to see that, until you're able to see that provider hospital, let them make that decision. Unless you see that it needs to be rewrapped and it's not controlled anymore, then you can proceed to do what is necessary. So again, that's where we're at. Again, I said I'll show you this pressure bar real quick. If you have any questions, now is a good time to ask, and we'll demonstrate this again. So again, here's this pressure bar, and as you pull it down, that pressure bar itself is applying the pressure onto the wound. All right, so if there's no questions, we'll demonstrate everything, and after we demonstrate everything, we'll provide the learner with feedback. Thank you for your time, and I appreciate you watching.